Welcome to the Bethania Group COVID-19 Outbreak Management Guideline. COVID-19 is a new strain of coronavirus that has not previously been identified in humans. It is spread through respiratory droplets generated through coughing or sneezing, through close personal contact, such as coughing or shaking hands, or touching something with the virus on it, then touching your mouth, nose, or eyes before washing your hands. It can also be spread through the air doing aerosol-generating medical procedures. The Bethania Group has implemented a number of strategies to prevent the spread of COVID-19 should it enter our home. As such, our PCH has taken the following actions to keep our residents and staff safe. Visitor restrictions. On March 16, 2020, our PCH made the difficult decision to lock all doors and restrict all visitors. This decision was made before the health region made the recommendation to lock down all personal care homes. Compassionate and end-of-life visits for families are considered and accommodated on a case-by-case basis. There are restrictions and extra precautions for deliveries. For example, parcels are held for 72 hours prior to distribution. On admission day, laundry is bagged and held for 72 hours. Personal belongings are wiped down. There are no food deliveries to residents unless those items are store-bought and packaging can be wiped down. Families are encouraged to only bring in essential items. There are limitations to recreation activities. There are no large group activities. Visits with loved ones are coordinated through a booking system and are structured to comply with physical distancing requirements. Virtual visits are accommodated using FaceTime and Duo. Some residents have also opted for window visits. Social distancing is in effect at meals and at meetings for residents and staff. The new resident seating arrangements and relocation of the staff break room to the park area allow for physical distancing requirements. Meetings are held in multiple sessions to avoid large groups and are also held via virtual means. Education is delivered via online training or through small group multiple sessions. Active screening. Staff and visitors are asked screening questions and have their temperature taken at point of entry. The single-site employment model is in effect. Staff are only permitted to work at a single personal care home. Asymptomatic testing is in place for all new admissions. Admissions are swabbed and tested for COVID-19 on admission day. They are restricted from attending group activities, will take their meals in their room, and will have their temperature and respiratory status monitored by nurses twice daily for 14 days. In addition, residents returning from a hospital stay of a 24-hour or longer duration will also be swabbed and tested for COVID-19. These residents will also have their temperature and respiratory status monitored twice daily for 14 days. Universal PPE is in place for staff in direct contact with residents. Our general population is located within a green PPE zone, meaning the residents in the green zone are not suspected to have COVID-19 and do not meet testing criteria. In a green zone, strict hand hygiene is required before and after contact with residents or their environment, as well as before and after donning and doffing PPE. Extended use of masks is permitted. Masks are required for all resident interactions. Masks can be reused. When storing your mask, place in a paper bag. Change your mask when damp, soiled, or damaged, and discard at the end of your shift. Extended use of eye protection is permitted. Eye protection is required for all resident interactions. Retain your eye protection for the duration of your shift. When removed, clean, disinfect, and store per protocol. Dispose if scratched or damaged. Gloves are not required for every resident interaction and are only donned according to routine practices and additional precautions. Remember to perform hand hygiene before and after removing gloves. Gowns are donned only according to routine practices and additional precautions. For example, if there is a risk of contact with MRSA, scabies, blood, and/or body fluids. Change the gown when damp, soiled, or damaged. Our nursing staff are continually monitoring residents for symptoms of COVID-19. A resident is considered symptomatic should they have one symptom in Category A or two or more symptoms in Category B. Category A, fever greater than 38 degrees Celsius or subjective fever chills, cough, sore throat, hoarse voice, shortness of breath, breathing difficulty, loss of smell or taste, vomiting or diarrhea of a duration lasting more than 24 hours. Category B, runny nose, muscle aches, fatigue, conjunctivitis, headache, skin rash of unknown cause, nausea, or loss of appetite. Symptomatic residents are immediately isolated to their room, placed on contact droplet precautions, and swabbed. Residents who are suspected to have COVID-19 or who meet the testing criteria for COVID-19 require orange zone PPE. In an orange zone, strict hand hygiene is required before and after contact with a resident or their environment, as well as before and after donning and doffing PPE. Extended use of masks is permitted for all resident interactions. Masks must be changed when damp, soiled, or damaged. Masks are also changed after breaks. Extended use of eye protection is permitted. Eye protection is required to be worn for all resident interactions. Retain your eye protection for the duration of your shift. When removed, clean, disinfect, and store per protocol. Dispose if scratched or damaged. Gloves are required for all resident encounters. Gloves are removed prior to leaving the room. Perform hand hygiene before and after removing gloves. Gowns are required for all resident interactions. Doff your gown before leaving the room and change between resident encounters. Also change when damp, soiled, or damaged. What happens if a resident tests positive for COVID-19? Despite all our efforts, we need to prepare ourselves for a COVID-19 case in our PCH. A resident with a positive confirmed COVID-19 test result will be relocated to the Tea House. At this time, the resident will be wearing a mask when transported to the Tea House on a stretcher. The resident's room on the unit will be locked and disinfected. At this time, all admissions to the personal care home will stop. In the event of a positive COVID-19 test result, a communication plan is in place to notify physician, medical director, infection control practitioner or designate, site leadership, WRHA, IPNC, and executive director. Most importantly, you and the resident's family will be kept informed. Once a positive case of COVID-19 is identified, nursing staff will begin the process of resident contact identification. The nursing staff will monitor and identify any other residents who have signs and symptoms of COVID-19. Residents with symptoms will be isolated, placed on contact droplet precautions, and swabbed. Residents in this scenario will be placed on orange zone PPE. Any resident with a positive test result will be transferred to the Tea House for care. The site infection control practitioner will also begin the process of identifying any persons, including staff, residents, or visitors, who had contact with the resident during the period of communicability. The period of communicability is the period extending from 48 hours prior to the development of overt symptoms. The site infection control practitioner will begin the process of determining staff exposure risk and will gather the following staff information: dates at work, area of work, PPE use, and the length of contact they had with the resident. A contact's exposure risk level is classified into a high, medium, or low risk level. A contact is deemed to have a high exposure risk level if they provided direct care, close physical contact with the case, or was exposed to their infectious bodily fluids and they were not consistently using PPE. If they had close or prolonged, meaning greater than 10 minutes of contact with the person during that period of communicability, so 48 hours prior to the start of the resident's symptoms, or if they had close or prolonged contact when the case had symptoms but was not in isolation. A contact is deemed to be at a medium exposure risk level if they provided direct care or had close physical contact with consistent and appropriate use of personal protective equipment while the case was in isolation. If they had prolonged contact, but they were socially distanced, at least being 2 meters away from the case. A contact is determined to be at a low exposure risk level if they had only transient interactions with the case, briefly walking by or being in the same room as the resident who has tested positive for COVID-19. The action a contact takes depends on their exposure risk level. If a contact is at a high risk exposure level, they must immediately self-isolate at home for 14 days from last unprotected exposure. They must follow good respiratory etiquette and perform good hand hygiene. They must self-monitor for symptoms, paying close attention for signs of fever or respiratory symptoms, such as coughing or shortness of breath. They must also take and record their temperature twice daily. If symptoms do develop, they must go for testing 24 hours after the onset of those symptoms. If a contact is at medium risk exposure level, self-isolation is not required. They must, however, self-monitor for symptoms for 14 days following their last contact. If symptoms develop, self-isolate and attend to a testing site when symptoms are present for greater than 24 hours. If a contact is at a low exposure risk level, no monitoring or isolation is required. The new COVID-19 isolation unit. The COVID isolation unit can accommodate 8 residents separated by barriers and curtains. Each resident area can accommodate a bed, a chair, commode, and will allow enough room to safely maneuver a mechanical lift. The unit will be staffed with 1 nurse and 1 healthcare aide who will be assigned to work on the unit. There will be a stocked isolation cart with PPE such as gowns, gloves, eye shields, and masks. Some of the features include a dedicated medication cart with separate locked storage room, a laptop and charting area, a 2-way radio, a phone, fridge, microwave, bathroom for residents, and separate staff entrance. The unit will be secure. The doors to 600 wing will be closed, and the entrance to the tea house will be limited to only essential staff, primarily the 1 healthcare aide and 1 nurse assigned to work on the unit. Safety. A call bell button is mounted on the wall that will ring at north if assistance is needed. In addition, a phone and 2-way radio is also in the room. As a red zone, full PPE must be worn upon entry to the unit. The COVID-19 isolation unit is considered a red zone. In a red zone, strict hand hygiene is required before and after contact with a resident or their environment, as well as before and after donning and doffing PPE. Masks. Extended use of the same mask between resident interactions is permitted on the isolation unit. However, masks must be changed when damp or soiled. Soiling also includes makeup stains. Masks must be changed if damaged, and masks are also changed after breaks. Eye protection. Extended use of eye protection is permitted. Change eye protection only if soiled or damaged. Remove and disinfect at breaks and at the end of the shift. Gowns. Extended use of gowns between COVID-19 residents is permitted except in situations that require additional precautions or when indicated for routine practices, for example, for exposure to MRSA, scabies, blood, or body fluid secretions. Change when damp, soiled, or damaged. Remove gown before leaving the unit. Gloves are to be worn at all times and do not need to be changed unless there has been contact with a resident. For example, staff who are on the unit and do not have physical contact with a resident do not need to change gloves. Gloves are only changed in between instances of resident contacts. Please visit the following links in order to view demonstrations of PPE donning and doffing procedures and mask extended use procedure. These videos have also been circulated to each department. The new COVID-19 isolation unit. Compassionate and end-of-life visits will be accommodated as required. One visitor is allotted per resident at a time. Window and FaceTime or dual visits will also be arranged. All visitors will be screened. They'll enter through a dedicated doorway at the tea house and must don full PPE for the duration of their visit. Meals will not be provided for families. Dietary staff will deliver meals on paper plates using designated trays. Meals will be left outside the unit, so dietary aides will not need to don extra PPE during meal delivery. COVID-19 unit nursing staff will leave trays outside of the unit for pickup after meals. Snacks will be stocked for residents in the dinette refrigerator. The dietary meal delivery schedule will be as follows. Breakfast will be delivered between 8:30 and 8:45. Dish and tray pickup will occur at 10 o'clock. Lunch will be delivered between 11:30 and 11:45. Dish and tray pickup will occur at 1 o'clock. Supper will be delivered between 4:30 and 4:45. Dish and tray pickup will occur at 6 o'clock. Snacks will be sent along with the morning meal delivery. Laundry supplies. Supplies will include a linen stock. The unit will have a supply of washcloths, towels, clothing protectors, and linens for bed changes. There will be a gray laundry bin and red bags for delivery and pickup of laundry. There will be a clean area for clean stock and a dirty area for soiled linen. Note, residents will be kept in gowns to reduce personal laundry. Laundry infection control and PPE. Routine practices are sufficient for handling laundry. No special care is required when laundering clothing. Laundry staff will be dropping off and picking up items from outside of the unit. If entering the COVID-19 unit, laundry staff must wear PPE appropriate for a red zone. This will include a gown, gloves, eye protection, and a mask. The gray laundry bin process will be as follows. The unit nursing staff will place laundry in red bags inside of the gray laundry bin, which will be located outside of the unit. Pickup of the bin will occur at 8:30, delivery and stocking at 4:30. Housekeeping infection control and PPE requirements. The COVID-19 unit will have a stock of cleaning supplies on the unit for nursing staff to use as needed. Housekeeping will perform daily routine cleaning of the kitchenette and washroom areas. Housekeeping will perform a top-to-bottom disinfection regimen of the residence room 72 hours after the transfer. A carbolized sign will be placed outside of the door when complete. Housekeeping staff will not be entering the designated resident area of the COVID-19 isolation unit. Since the unit is a red zone, housekeeping staff must don the following when entering the unit: a procedure mask, housekeeping gloves, eye protection, and a gown. Housekeeping PPE. Extended use of the same mask and eye protection for repeated interactions is permitted for multiple patient rooms when on the isolation unit. The mask must be discarded after leaving the unit. Eye protection. Extended use of eye protection is permitted. Eye protection must be removed and disinfected after leaving the unit. The gown. Housekeeping staff must remove their gown before leaving the unit as per routine practices and additional precautions. For example, if there's a risk of MRSA, scabies, blood, or body fluid contact or excessive soiling. Gloves are applied and changed per routine practices and additional precautions. Hand hygiene is done before and after donning or doffing gloves or contact with patient or a patient environment without gloves. Housekeeping daily schedule. The areas cleaned will include the kitchenette and the washroom. This will occur at 3:15. Other tasks include routine cleaning, garbage removal, and replenishment of supplies. Maintenance. Maintenance will be responsible of transferring the resident furniture to the isolation unit. Maintenance will move the resident's bedside table to the unit once packed by nursing staff. Maintenance will also move the resident's bed to the unit once the bed has been carbolized. Maintenance will also be required for routine maintenance as needed. Maintenance staff will wear the following PPE when entering the COVID-19 isolation unit as per red zone PPE requirements: the gown, gloves, mask, and eye shield. Recreation will assist in identifying items in the residence room that may be needed on the isolation unit. They will also identify residents and family who would benefit from FaceTime or duo visits. Recreation will assist in calling family using the COVID-19 PCH script to inform them of the COVID-19 outbreak. Spiritual care. The chaplain will provide one-to-one support as required or when consulted to residents on the COVID-19 isolation unit. The chaplain will wear PPE consistent with the red zone when attending to the unit. Social work. Social work will assist in conducting phone call notification of COVID-19 to families using a script. Social work will also provide support and discuss outbreak management plans with the affected families via the phone. At this time, all admissions will stop. Nursing clerk. The nursing clerk will send interdepartmental email notification of affected residents who are transferring to the COVID-19 isolation unit. There will not be a change to the resident's room number. The clerk will create a sign for the resident's bed area on the isolation unit, which will include their name and their room number. The clerk will also create addressograph labels for charting. These labels will be kept in the hard copy of the chart. In preparation of the resident's transfer to the isolation unit, healthcare aides will pack only essential items that the resident might need, which will include their basin, bedside lamp, peri-wash, personal lotions or creams, pull-ups or briefs, and any necessary clothing, such as a cardigan and slippers, into their bedside table. Note the resident will be changed into an isolation gown when on the unit. Nurses will place the resident's medication, including their prescription creams, eye drops, needles, subcutaneous lines, moisture spray, end-of-life medication, and puffers into the isolation medication cart. This cart will be locked in a storage room on the COVID-19 unit. Nursing will also bring designated equipment as applicable to the tea house. This may include the BP machine, thermometer, slings, lifts, commodes, and oxygen. Nursing will also bring assistive devices, updated room logos, the care guide, care plan, ADL sheets, and paper chart to the tea house. Nursing will also ensure that bed linens are on the COVID-19 unit bed. In preparation for the transfer, the resident will be changed into a gown. A mask will be applied on the resident. The resident will be transferred onto the stretcher. Communicate with the units when transferring to avoid transport through crowded areas. Once on the unit, orient the resident to their new surroundings. The healthcare aide's daily duties will include assistance with ADLs, daily bed bath and bed linen changes, feeding residents, ADL charting, monitoring supplies and stock on the unit, cleaning as needed of resident areas, providing one-to-one support, and assisting with virtual or window visits as needed. Nursing staff daily duties will include daily communication with family and respective progress note documentation, medication administration, administering treatments, ongoing assessments of resident status, and assisting with ADLs and virtual or window visits as needed. The COVID-19 isolation unit staffing complement will include one nurse and one healthcare aide on days, evenings, and nights. One staff must remain on the unit during breaks. Consistent staffing is preferred for continuity of care and to further reduce the risk of transmission. COVID-19 unit. Unit staff will enter the building using the 600 wing T-house entrance from the parking lot and will be screened by the nurse from the previous shift. Staff will bring a bag change of clothes and shoes. Staff will use a designated change room outside of the T-house to change their clothing and footwear. Daily huddles will occur with nursing leadership. Red zone PPE must be worn at all times when entering the COVID-19 isolation unit. This will include gown, mask, eye protection, and gloves. We need you. You are the key. It takes the daily commitment and dedication of every staff member to keep our residents safe. Your diligent service is greatly appreciated. Thank you.